Hello everyone. In this video, I will be sharing another US FDA new drug approval update. On March 24, 2026, the US FDA granted an accelerated approval for AVLAYAH tividenofusp alfa, which is indicated for the treatment of neurologic manifestation of Hunter syndrome, Mucopolysaccharidosis type 2, MPS II. This FDA new approval represents the first enzyme replacement therapy to penetrate the blood-brain barrier to reach the brain in addition to targeting peripherally. Now, let's dive into this medication in more detail. Tividenofusp alfa, brand name AVLAYAH. This medication was approved by the US FDA on March 24, 2026, and indicated for the treatment of neurologic manifestation of Hunter syndrome, Mucopolysaccharidosis type 2, MPS II. When initiated in pre-symptomatic or symptomatic pediatric patients weighing at least 5 kg, which is 11 pounds, prior to advanced neurologic impairment. Hunter syndrome, a rare inherited lysosomal storage disease, is caused by a deficiency of enzyme iduronate 2-sulfatase IDS, which breaks down the glycosaminoglycan in the lysosome. The accumulation of GAGs leads to lysosome dysfunction in peripheral and central organs and tissues. Chemically, tividenofusp alfa is a fusion protein therapeutics containing the hydrolytic lysosomal glycosaminoglycan GAG specific enzyme iduronate 2-sulfatase IDS, linked with an engineered immunoglobulin G1 IgG1 Fc component of the enzyme transporter vehicle. The molecule weight of tividenofusp alfa is approximately 110 kilodalton. This medication is available as 150 mg as a lyophilized powder in a single-dose vial for reconstitution and further dilution, which is for intravenous IV infusion use. Recommended dosage. This medication follows a dose escalation regimen. Starting dosage, week 1 to week 4, 3 mg per kilogram. Intravenous IV infusion over approximately 4 hours once weekly. Week 5 to week 8, 7.5 mg per kilogram. RV once weekly. For maintenance dosage, week 9 and beyond, 15 mg per kilogram. RV infusion once weekly for pediatric patients weighing at least 5 kg, which is 11 pounds. See full prescribing information for details. This medication also carries a US box warning: hypersensitivity reactions, including anaphylaxis. Mechanistically, this medication works to provide an exogenous source of iduronate 2-sulfatase enzyme, RDS, specifically the binding of the Fc region of tividenofusp alfa with the atypical domain of the transferrin receptor TFR, facilitates the RDS delivery to peripheral tissues as well as to the CNS through receptor-mediated transcytosis across the blood-brain barrier, BBB. Once delivered, this enzyme hydrolyzes these complex sugars and decreases accumulated GAG levels. Pharmacokinetically, the mean volume of distribution of tividenofusp alfa is 2.7 liters. Metabolism. This medication is expected to be metabolized into small peptides and amino acid by catabolic pathway. Contraindications. Currently, there are no contraindications listed on the prescribing information. The most common adverse effects greater than or equal to 20%, infusion-associated reactions, IARs, upper respiratory tract infection, ear infection, pyrexia, anemia, cough, vomiting, diarrhea, rash, COVID-19, rhinorrhea, nasal congestion, fall, headache, skin abrasion, urticaria. Here are the key references which I have used to prepare for today's video. The US FDA New Drug Approval Updates for 2026 is a very valuable resource. In addition, most of the medication information which I shared today is based on AVLAYAH prescribing information. This document is available at the US FDA drug website along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you find this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.